أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم نحمده ونصلي على رسوله الكريم أما بعد. Welcome again, dear viewers, to Medicine and Islam, a program sponsored by Sharjah Television that features topics relevant both to the field of medicine as well as to the great religion of Islam. Alhamdulillah Rabbil Alameen. Last week we started talking about women health issues again. That was part 4 of a 3-part miniseries. Today is part 5, and our topic today is approach to women's health across different ages. And today we're focusing on the 40s and 50s. Of course, our guest again is Dr. Sawsan Al Madhi, Secretary General of Friends of Cancer Patients and a representative of the Sharjah Supreme Council for Family Affairs. Dr. Sawsan, Assalamu alaikum.
Alaikum assalam.
Welcome back.
Thank you, Dr. Bilal.
First of all, I want to thank you for last week's program. It was very good. I know I learned it out, and I'm sure that our viewers did. Now, today we're going to step it up to the next age group.
Yes.
We're going to go to 40s and 50s. And so, inshallah, I want you to, first of all, give us a bit of contrast just between these two age groups. Between the 20s and 30s and 40s and 50s. So what's the first thing that pops in your mind?
Well, the 40s and 50s, again, we're going to divide them back again to women-related health issue and non-women or the general related health issue. Now, that age, 40 and 50, again, it's in the 20 and 30, the woman, the lady was younger. She's in that fertile childbearing age. Now she's a little bit older, in her 40 and 50, and at those two ages, which is the age group, which is 40 and 50, we start to look more closely at cancer-related diseases.
Right.
Now, before going into that, there is lots of women-related health issue which is common in those age group. We spoke about fibroid the last time.
Right.
We spoke about incontinence the last time, and we already spoke about what are the symptoms and what should the lady do if she has it. Again, those two issues pop up in this two age group, which is the 40 and 50. What is new about this age is that this is the age where menopause happened. And a premenopausal, or the time it takes for a woman to become menopause, can extend to up to 10 years. So actually, premenopause can actually start 10 years before the actual menopause. And when we say menopause, this is the time where the periods stop for a woman. And the woman starts to have lots of symptoms like hot flashes, dryness, the bone gets affected as well. So all that can actually happen 10 years before, and it's all related to the hormone of the body.
And how long will the actual menopause last once it starts? What's the range?
Well, it's according to the woman itself. It's according to the woman herself. I mean, some women can take up to 6 months for the period to become irregular and then stop. You know, that's it. Stop definitely. And some women take more, and some women take less. So it's according to the woman herself. But the actual premenopause can actually start even 10 years before. The menopause itself, the woman can expect it to have it in her 50s. So it's actually from 50 to 55, unless it runs in the family that her mother or her sister had a mature menopause. Some lady can actually have a menopause at the age of 40 or 35.
Okay.
So it's
that's
according.
Considered early, actually.
That's considered early, and that's according to the family history. If that's the kind of family it runs through, then this is how it is. There is lots of remedies and cures because irregular menses, hot flashes, sweating, that's a huge thing for women. And there is lots of remedies and cures that a woman can actually undertake and undergo to cure that.
Now, is depression also
yeah, absolutely.
possible factor?
Yeah, absolutely.
It can be quite severe sometimes.
Yes,
also.
yes. Some doctors put the woman on the pill, which is a combination of estrogen and progesterone, for a long time. I wouldn't recommend it more than 2 years for the woman, because there is lots of problem with the pill. It's a hormone, and you're giving it to a woman, and there is a huge research that was done in the U.S. Back in late 1999, and it's called the Women Health Initiative, and they compared the women who were taking the pill to other women, and they said, well, there's a huge number of women and a huge percentage where women actually develop breast cancer and uterine cancer because they were on the pill.
Right.
So it's not recommended more than 2 years, actually.
In the old days, meaning in the 70s and 80s, when I was practicing medicine in States, that was indefinite. That Premarin was giving ongoing for years and years and years.
There is a rationale actually behind giving a woman the pill. It's actually, it relieves the hot flushes, it relieves the sweating, it improves her mood, it actually prevents the osteoporosis part. And also it's a protective for the heart. And the thing is, when you really take a closer look at what you're giving and the benefit and the disadvantage, we can actually prevent the bones from getting osteoporosis. We can prevent the heart with other measures than the pill.
Right. You don't need that for that.
You don't need that. So there are new measures now, and the lady can take vitamin D and calcium for the bones. She can take other medication as well for the heart. She can do a regular checkup, improve her diet, cut up the fat, take a baby aspirin, which is 100 milligram per day if it's needed as a protective. Also, for the hot flushes, there's lots of remedy now for it. The way she dresses, primrose oil as well, which is just a natural substance, and that she can just take it as a tablet. So there's lots of things now she can do. But again, if she has to, because some people, they have the hot flushes and the sweating, it's so bad that even those normal remedies don't work. So she has to go on the pill. But it's not recommended to do it more than 2 years.
Okay, good. One thing that came to mind that I thought we should just talk about briefly is that there's basically an increased risk of complications for pregnancy of women in that 40 age group, 40 to 50 age group.
Yes.
We haven't talked about that yet, and I just want you to kind of touch on that briefly.
Yes, the thing is, we're living in this age where actually even marriage age has been delayed, and getting pregnant even is becoming more delayed. So let's say 20 years back, we used to have people getting married in their 20s and 30s, and now nowadays we tend to have people getting married in 30s and 40s actually. So yes, we do have people who are getting pregnant in their 40s, and that's fine because we have the modern technology to deal with those cases.
Absolutely.
But what happens is when a woman gets pregnant in her 40s, there's lots of complication for her and for the baby as well. So one of the complications that usually a woman will face, but I'm not saying that she will face, but she might face, is having hypertensive or diabetes, gestational diabetes, while she's pregnant. Also, the baby itself, there's lots of genetic. He can have lots of genetic abnormalities, like Down syndrome, which is very common if a woman gets pregnant after the age of 45. But again, regular checkup with the doctor, regular follow-up, regular ultrasounds.
You got ultrasounds, you got amniocentesis.
You have lots of things, yes.
Absolutely.
And definitely it can be caught early, and there's lots of things that can be done.
It's a concern, but it's something that needs to be properly approached.
Absolutely.
Very good. Now, in the last program, we mentioned the vitamin D.
Yes.
And we said it was going to come back.
Yeah.
So here it is. I think as you get older, this concern of vitamin D deficiency and osteoporosis increases with age.
Absolutely.
So now we've got to talk about it again. What about this age group?
So as you're saying is, we spoke about vitamin D and the age group of 20 and 30s, and that was for a reason, and that is because, as I said before, there is a huge concern about vitamin D deficiency in the United Arab Emirates population. And prevention is better than cure. So if you start early by taking the necessary precaution, increase your dairy product, safe exposure to the sun, that will be great because it will help you when you reach this age group, which is the 40 and 50. I like to link the problem with the bones with the fact that in the age group of the 50 is where you're going to have the menopause, or the lady's going to have the menopause, and that's where actually the problem happens. if she has good bones, then with regular exercise and also regular checkup of her bones, she will not have a problem.
Okay.
But the thing is, she needs to have really good bones from really young age. It's not that she just suddenly going to decide in her 40 and 50 that, fantastic, I'm going to start taking calcium or vitamin D and that's it, it's going to solve the problem. If the problem is there from the 20 and 30, even having the supplements like calcium and vitamin D in the 40 and 50 will not solve the problem for her. So that's why we mentioned the vitamin D in that previous age group.
So what's the solution for this problem?
It's just getting the sufficient calcium and vitamin D at a younger age. Sufficient calcium, I say, is by eating dairy products. Sufficient vitamin D is by safe exposure to the sun. In the 40 and 50 age group, even the type of exercise is different. It's the type of exercise you need to do to build up muscle. If you build up muscle, if not just building up, it's strengthening up your muscle. Toning the muscle will help to strengthen the bone. Okay, so that's how you should do it. If you are more of an aerobic person and go and that in the 20 and 30, aerobics, what it does is it just burns fat. It burns the calories.
Right.
But to lift weights, that's very important because that tunes up the muscle. Regular checkup for the bones, that's very important. And we have a Friends of Arthritis group who actually do lots of campaigns for women, and they screen for bone disease in them. So maybe the audience can actually check with the Supreme Council if they have anything running right now. Okay,
I like to you really said a nice point. A lot of people don't know the difference between aerobic exercise and anaerobic exercise, because this is something, when we talk about diabetes, they always say first you need, the aerobic, but then the anaerobic becomes important as you get older because of the bone.
Exactly.
When you said that the muscle exercises of the anaerobic strengthens the bone.
The bone, yeah.
That was a great point.
Yes.
So I think you just want to kind of elaborate a little bit on that.
Well, aerobic exercise is just pumping extra oxygen and breathing more, and that's you do it by running, doing certain movements. And the whole idea of that is to increase the cardiac output or increase your heart rate.
Right.
And when you increase your heart rate, your body wants to start burning calories. And this is actually what aerobic exercise does.
Right.
Now, the other type, which is like lifting weights, those kind of exercise, it actually tones the muscle and it makes it more stronger. It doesn't necessarily mean that you're going to do extra effort to increase your heart rate. It doesn't. Those kind of muscle doesn't.
That's not the objective.
No, it's not the objective. The objective is to actually do repetitive movement to increase the tone and the strength of that targeted muscle. Maybe a sports expert will elaborate, but this is how this is the basic understanding and explanation of doing an aerobic. So the perfect exercise program is to combine the two.
Right.
So you should do aerobics maybe for like half an hour or maybe 15 minutes, and then do some muscle building. And I don't want you to be as bulky as, let's say, the people we know.
Right.
But the thing you need to do is just have enough, just to strengthen the muscle. That's what you need to do.
Absolutely. SubhanAllah. Okay, that's very good. Any other last-minute advice? Because we're just about out of time for women in this age group, 40s and 50s. Last thought?
Absolutely. We said in the beginning of this episode that this is the targeted age group for cancers. So there are two types of cancer that we need to look out for. Breast cancer, and we start screening ladies for that by doing a mammogram at the age of 40. And we repeat the mammogram every maybe 2 or 3 years for them. The other type of cancer, which is very common in this age group, is ovarian cancer. And again, a simple ultrasound, maybe on a yearly basis, will definitely reveal that in time for the woman to get checked.
Is the ovarian cancer actually more common than cervical cancer in this age group? About this age,
It's more common, yes, in this age group it's more common. Yeah, it's more
Very
common.
good.
We still check this age group for cervical cancer as well with pap smear.
course.
We definitely still
Easy to
continue with
do,
that.
yeah.
But again, we have those two popping up in those age groups.
Okay, with ovarian cancer, how do you do the screening now? Just briefly?
It's just the ultrasound.
Just the ultrasound.
Absolutely.
Okay, very good. Thank you, Dr. Sawsan.
Thank you.
One more time, we want you back for the last age group, 60 and
Inshallah.
above. Inshallah. My dear viewers, we have one more episode regarding the approach to women's health across different ages. Next week, we'll be talking about the ages of 60 and above. If you have any questions, you can write me a Medicine Islam P.O. Box 111 Sharjah Television, Sharjah, UAE. Or you may send me a fax at 9716-5311-969. Or you may contact me at our website, which is Medicine in Islam at sharjatv.ae. And as our custom on Medicine in Islam, we'd like to conclude all of our programs with a short prayer of the Prophet Muhammad, peace be upon him. And inshallah, with that dua, that all sins will be forgiven, all mistakes will be forgiven. Thank you very much. We hope to see you next week. Assalamu alaikum.